This special edition episode is sponsored by Liquidia. Please see the important safety information following this podcast. The prescribing information and instructions for use for YUTREPIA, treprostinil, inhalation powder, are available at YUTREPIA.com. YUTREPIA is approved for the treatment of pulmonary arterial hypertension PAH, WHO Group 1, and pulmonary hypertension associated with interstitial lung disease, PH-ILD, WHO Group 3, to improve the ability to exercise.
Hi, welcome to I'm Aware That I'm Rare, the PH Aware podcast. I'm your host, Steve Van Wormer, and today we're here with Dr. Rodolfo Estrada from UT Health in San Antonio, Texas. He's here to tell us about some exciting happenings that are taking place in the world of pulmonary hypertension and a new therapy that's been brought to market. Dr. Estrada, welcome.
Thank you so much for having me. It's really great to be here. As mentioned, I'm Rodolfo Estrada. I'm a pulmonologist at UT Health San Antonio, and there I lead the pulmonary hypertension program. My focus is now on caring for patients with pulmonary arterial hypertension, or PAH, and advancing research in this area.
Dr. Estrada, it's a very interesting time in the world of pulmonary hypertension. There's a lot of moving parts, a lot of changes taking place in the community, and I'd like you to share a little bit about where we are today.
You're absolutely right. Even if we've made all this progress in PAH is still serious, and it's a progressive disease that can take a big toll, not only on the patients, but also on caregivers and families. We've improved a lot in diagnosing it earlier and managing risk more precisely. We have more treatments available now than ever, but we still face big challenges. Diagnosis often comes out late, and many patients can't tolerate the medication or don't have access to advanced therapies when they need them the most. For example, data from the REVEAL registry showed that only about a third of patients had received any form of prostacyclin, and half of those who died had never been started on IV therapy. And we get it, these medications really aren't easy. The side effects can be tough, and depending on how they're given, especially with IV or sub-Q options, there's a real risk of infection or complications from the delivery method. That's why inhaled prostacyclin have become an important alternative. Delivering the medication straight into the lungs helps reduce the side effects you might get when the drug circulates around the body. But even with inhaled options, there are some hurdles, like needing frequent doses, challenges with breathing patterns, and a ceiling effect at times of how much you can increase the dose.
Now here's where things get exciting. A new inhaled prostacyclin called YUTREPIA was recently approved. It's a dry powder inhaler that delivers medications using a special technology that's called PRINT that makes uniform particles just 1 micron in size. These particles travel deep into the lungs where they are needed the most. The medication comes in capsules that you load into the device, and then you puncture the capsule and take 2 breaths 4 times a day. This device requires low effort from the patient. It seems to be well tolerated and easy to use, and hopefully this will help with the adherence of these patients.
It's always an exciting time when there's a new tool in the toolbox for doctors and healthcare providers to offer patients. Can you tell us a little bit about your experience in this clinical trial and the patients you saw that really led to this approval?
Sure, happy to. In the phase 1 study of YUTREPIA, they found that 79.5 micrograms of YUTREPIA gave similar systemic exposure to about 9 breaths of nebulized treprostinil. Where another analysis showed that patients had a greater survival and longer time before starting parenteral therapy when they were on doses greater than this threshold of 79.5 micrograms 4 times a day. Then there was a study called INSPIRE, which was a phase 3 open-label multicenter trial that included about 121 patients. And these patients were either started on YUTREPIA or they transitioned from nebulized treprostinil. And the main goal was to see if the medication was safe and tolerable, and it was. The study included patients with PAH and WHO functional class 2 and 3. And everyone had to be able to walk at least 150 meters and had good lung function. Most patients were on background therapies, and patients had been diagnosed with PAH for about 7 years on average for those who transitioned and about 4 years for the ones who were newly started. Those transitioning had to be on stable nebulized treprostinil for at least 3 months. They also used an exploratory analysis to look at things like 6-minute walk distance and patient-reported outcomes. And on average, patients who were new to prostacyclin showed improvement, especially as doses increased, and those who transitioned didn't lose ground in their exercise capacity. Notably, 100% of patients who transition from nebulized treprostinil say they prefer to stay on YUTREPIA after a few months of trying it.
Can you walk us through a little about how the medication was being used in the INSPIRE study? Or tell us what kind of doses the study was aiming to achieve?
The way the trial was done is patients were started on 26.5 micrograms 4 times a day, with weekly increases up to a maximum of 212 micrograms 4 times a day. By 2 months, 78% of the transition group and 71% of the treatment-naive group were above the key threshold of 79.5 micrograms 4 times a day. At 1 year, 40% reached a dose equal or greater to 132.5 micrograms, or what's the equivalent of about 15 breaths of nebulized treprostinil. In the open-label extension, about one-third of patients reached a dose equal or greater than 159 micrograms, which is about 18 breaths of nebulized treprostinil. And even at 2 years, there were patients who reached up to 238 micrograms, which is about 27 breaths of nebulized treprostinil.
In our center, we had a couple of patients in the trial who reached some of the highest doses, even in a woman in her 70s, which again, trial patients may not necessarily represent the real world. They tolerated it well and stayed at low risk longer, really without needing additional therapy.
So in these trials, what were some of the potential side effects that patients experienced as they went through the trial?
That's a good question. The side effects were similar to other inhaled prostacyclins like cough, throat irritation, headaches, and dizziness, and these were mostly mild to moderate and tended to show up more in the treatment-naive group, as you would expect. Importantly, though, at 1 year, no patient in the transition group had to stop the medication because of cough, and only 2 patients in the treatment-naive group had to. About 10% left the study due to side effects, but none of them were serious adverse events that were linked to the medication.
So you had this successful trial, and that's led to a successful approval. Now that there's a new drug in your toolbox, what happens when a new therapy comes into play in the real world versus when it's used in a trial group of patients?
When we're doing trials, we're trying to answer a very specific question. And to be able to answer that specific question, we try to narrow the population that we can get the answer for. What happens in real world is that then the exposure of whatever intervention we did, medication or whatever else we do, would be then offered to a broader range of profiles. And then things that we may have not picked up on trials, then we pick it up in the real world. Sometimes great, sometimes not as great. When you do a trial, and it's a specific number of patients, usually smaller number of patients than real world, as you get more exposure in the real world, we'll learn new things that we didn't know about it before.
So what's great here in summary, doctor, is that we have a whole host of options for PAH patients, including YUTREPIA here, but also exciting for the PH-ILD population that has formerly only had one option. So when a second option, a new option is laid out, how does that change the playing field for both of those subsets of patients?
Yeah, it's a great point. We now have another inhaled option with YUTREPIA, which is now approved for not only PAH, but also PH-ILD. And it's a convenient dry powder inhaler that requires low effort from the patient and seems to be well tolerated and easy to use, which may help with the patient's adherence. And from what we've seen, it offers a chance to deliver medication deep into the lungs, hit high doses, and potentially improve outcomes for patients who may not tolerate or access other forms of the medication.
I really appreciate you being here today, doctor, to tell us about this exciting news for patients, exciting news for the healthcare providers like yourself, and thankfully to sponsors like Liquidia for the work they're doing to better the lives of patients with PAH and PH-ILD.
Thank you for having me today, Steve. It's really been a pleasure talking to you about this today. And for the patients listening, what is always exciting to have a new medication available in the space. It is very important that you discuss the specific therapy plan that is best for you with your specific therapy providers and teams. My name is Rodolfo Estrada, and I'm aware that my patients are rare.
Please see the important safety information in the show notes. The prescribing information and instructions for use for YUTREPIA are available at YUTREPIA.com.